Namaste. My name is Anarkha Sanal, a final year student of BA PAP in School of Performing Arts and Indic Studies, REVA University. I have been very lucky to do an internship with IKS under the Ministry of Education at AICTE. The research lasted for more than 2 months, where my topic was to analyze the significance of Indian music therapy systems, specifically in amnestic patients. The paper aims to provide a general background in the significance of music therapy on patients with amnestic disorders depending on the etiology. The study provides clear understanding in music therapy as an effective intervention for different types of neurological amnesia. The basic idea was to set up sessions with patients who suffer from amnestic syndromes. We have even included stage 2 dementia patients by examining the progression and changes in different stages to understand how it varies from CDR1 to CDR3 in the early, middle and late onset. The CDR is based on a scale of 0 to 3. We have conducted sessions in Kalyani Raga, Malhari, Sarali and Jandavarisagal and by chanting Om. The Galveston orientation scale was used to understand before and after effects. As a result of improving the study and taking it up further, I would like to introduce different Indian musical instruments in order to understand the neuropsychological and neuropathological changes. Music and the brain. Indian music has a rich tradition and is known for its therapeutic benefits. When it comes to using Indian music as a therapy for amnestic syndromes, there are several aspects to consider. Ragas and instruments. Ragas are specific melodic structures that evoke specific emotions and moods. Each raga has a unique combination of notes and is believed to have a therapeutic effect on the mind and body. By selecting appropriate ragas, it's impossible to stimulate memory and evoke emotional responses in individuals with amnestic syndromes. Similarly, playing specific musical instruments can also have a positive impact on cognitive abilities and sensory integration. Cognition and motor control. Listening to Indian music involves a complex perception and cognition. It requires the brain to process and interpret various musical elements such as melody, rhythm, and tonal variations. This engagement of cognitive processes can help stimulate and enhance cognitive functions, including memory, attention, and concentration. Additionally, the motor control involved in playing musical instruments can improve fine motor skills and coordination. The Nada Chikitsa, also known as sound therapy, is a therapeutic approach that uses specific sound frequencies and vibrations to promote healing. The use of specific ragas and musical instruments can create vibrations that resonate with different parts of the body and the energy centers or chakras. By aligning these vibrations with the corresponding chakras, it is believed to restore balance and promote overall well-being. Amnestic syndromes often involve deficits in sensory processing integration. Classical music with its intricate melodies and rhythms can provide a rich sensory experience. By incorporating classical music into sensory integrative therapy such as auditory, oral, motor and visual motor activities, individuals with amnestic syndromes can benefit from enhanced sensory perception, improved attention and increased engagement. Activation of engrams. Engrams are the neural representations of memories in the brain. Music, especially when associated with personal memories and experiences, can activate these engrams, helping individuals with amnestic syndromes retrieve memories and enhance their sense of identity and connection. Introducing familiar music as an external stimulus can trigger emotional responses and facilitate memory recall. It's important to note that the use of Indian music as therapy for amnestic symptoms should be tailored to individuals' needs and preference. A live session from day 1 to day 25 to observe the changes. The application of Kalyani Raga and Om was introduced. The Arohana and Avarohanam was sung by 3 times in a repetitive manner. The patient started chanting Om in various raga modulations, which increased his rapport. External disturbances affected patient's attention in the middle. Chanting Om and singing swaras helped a lot to retain his presence of mind. Day by day, his attention efficacy were improved. No respiratory exercises were noticed, giving them enough time to understand and feel that the existence is very important. For different patients, the therapeutic tool varies according to their MSc and previous history. The basic idea of this study was to conduct music therapy sessions with patients who suffer from memory loss. So, memory loss in the sense, we have taken patients specifically who suffer from amnesic symptoms. We have even included patients who has stage 1 dementia. We calculated the level of memory loss or the severity of the illness using Galveston orientation scale. While I was researching or while I was studying about this topic, I understood that India has an increased number of memory loss patients and why this happens. But in some cases, but not majority, even though in some cases, our day-to-day routines or stress, anxiety can also be a part in that. While conducting all the sessions, the final result gave a very significant change in the patients who suffer from amnesic symptom disorder. I found this internship very helpful and experience to be positive. I would like to thank a large number of individuals for their immense support and cordial cooperation. I would like to thank the School of Performing Arts and Indic Studies of REVA University for the immense support throughout my internship. Thank you.